But you always hear, like, every now and then you'll hear about a golfer that was ready to quit.
Mm-hmm.
They couldn't make the cut. They were struggling. It was too much. And then all of a sudden they win a tournament or something,
Yeah.
and then
Yeah.
they're revived for the
Garrett.
next,
Yeah.
few years, not only because of the payout, but just like confidence.
Oh my gosh.
sure.
Talk about a segue.
Yeah.
Are you kidding me?
Let's go.
Wow. Okay. Well, hey, welcome to the Well-ish podcast, sponsored by Iowa Specialty Hospital, where real life meets better health. We're your hosts. I'm Derek.
I'm Anthony.
Let's
dive in.
This is the Well-ish podcast. I'm Derek. That's Anthony. We're still your hosts.
How you like when I say it?
Well, depends.
Okay.
I'm super excited about that segue. I couldn't help myself. We are so excited. We are here today with Jon. He is PA here at Iowa Weight Loss Specialists that both of us have gotten to work with in a variety of capacities. We're obviously dietitians. And so just super pumped to have you in. And you talk about like that, like what you said, like that struggle constantly, like not achieving, and then having that breakthrough, right? And that has to be something that you get to see with your patients every day or week or month, or it's got to pop up. So we can get into that here in a little bit, but first off, how are you?
I'm doing great. I appreciate it. This is fun. I'm on side conversations with you guys. I always enjoy it. Derek, I think you even observed me maybe to see a patient or two. I can't remember if you did or not, Anthony.
I honestly can't. Oh, I did. I think I got everyone. I was
Did
like
you?
one of the only ones
Okay.
that, I got everyone.
Unfortunately, I never get to do that. As a provider here, I don't get to observe other people and kind of their styles and bedside manners and stuff, which is unfortunate because you probably learn a lot from that.
Yeah. Do you feel like that's something that would be like, I mean, it sounds like you'd like that.
I would like it. Yes. I mean, I know for some, I can about imagine how, like Dr. Ibis, I've been around him a lot, been working with him for 12 years now. So I could probably anticipate what he's going to say based on what the patient says. But everybody else, I don't know exactly what their style is. And that's the great thing about medicine is it's just unique to them. Everybody has a different style. Sometimes it's well received by the patient, sometimes not. So,
well, gosh, if you're ever up in my neck of the woods, feel free.
I'll take notes. Like,
that's fine. That's fine. I love it. That's great. Sit in. I would love it. That would be super fun. Not in like, because I mean, obviously you wouldn't be in there as like, all right, I'm like grading you kind of way, right? But it's more of like how are other providers communicating with their patients? Because you can learn so much from that.
Oh, definitely.
And I think across the board too, like not just, NPs to NPs or PA to NP, like dietitians, therapists.
Yeah.
I mean, therapy might be a little bit challenging to get into those, but I think it might be good like once a year to kind of have people sit in on you to also make sure that, maybe you aren't getting too content or repetitive,
Sure.
How can you kind of keep things or have someone give you some constructive criticism on something?
Sure.
Right?
Yeah.
But to your point about, some people might receive it well and some patients might not. I think that's kind of the beauty about, I tell this to everyone about our clinic here is that we have multiple providers with different experiences and different expertises. And that, if you don't like one, which is totally okay and understandable, try someone else.
Yeah.
Right?
Absolutely. And I think that applies to all the areas here, whether it's a dietitian, maybe somebody prefers a female versus a male, or we know certain dietitians might stress a little bit more with exercise, right? And so hand picking that is important. And same with like mental health therapy, which by the way is a huge part of the patients I see post bariatric surgery. And I know we'll probably get into that a little bit too, but you might, age can matter. Are they going to relate better to a certain therapist versus the other? So there's a lot of decisions to be made too when we're referring on.
Yeah.
So
definitely. Yeah. Well, I guess before we get too deep, let's back this up a little bit.
Yeah, sure.
Let's start with, who you are, Jon, where you came from. You can elaborate however much you want or however little you want, and then we can ask questions, but tell us a little bit more about who you are and kind of, your background a little bit.
Yeah, sure. So we're going to go way back here because I often get asked, when did you know that healthcare was going to be kind of the area that you're going to land? And honestly, I remember in high school, watching like TLC cable channel, and they had like plastic surgery. They had like
Oh, yeah.
facelifts on TV back in the day. I remember just being really fascinated by that and wondering, not that I wanted to be a surgeon, but just that healthcare might be an area where I was interested in. So I did end up going to Northwestern College in Orange City.
Yeah.
I started thinking maybe athletic training, something related to sports. I played basketball there in college, so I was around sports injuries and that sort of stuff. Found out what the requirement was going to be for that with the hours with athletic training.
Ooh,
And because
yeah.
I played basketball, I thought there's no way I'm going to be able to do this in 4 years. So kind of went away from that, ended up getting my degree in exercise science. So somewhat related to the athletic training.
Yeah.
My plan initially was maybe physical therapy. I wasn't quite sure. I did an internship after my undergrad in Omaha, Nebraska, and it was with cardiac rehab. And so at the time, you know, with an exercise science degree and then maybe potentially getting a master's, that was one of the main jobs. A lot of people like that. So I learned a lot from that internship. I was exposed a lot. It was in cardiac surgery observing there. The nurse that coordinated that did an awesome job of just kind of exposing me to different areas. After that internship, I decided, I don't think I'm going to go the cardiac rehab route. So started working in different odd jobs, started selling fitness equipment in Omaha, did that for a while. And then I moved out to Denver, Colorado. And out there, again, did other jobs, but I actually started working in a sleep disorder clinic. And I would stay up, you know, get people wired up and observe them all night. So stayed up all night. It was crazy. Great experience. It was also great just being in Denver, which was something unknown to me. I grew up in Iowa, small town Iowa, went to college in Iowa. So just really explored a lot of things there in terms of what I wanted to be when I grew up. So it was great. I would encourage anybody to, you know, get out of your comfort zone a little bit, especially at that point in my life. I thought it was really good for me. So got exposed to healthcare there through the sleep disorder clinic. I actually worked in a physical therapy clinic there for a while as well, and kind of crossed that off my list after being a tech or an aide there. Once I moved back, I got engaged. My wife moved out there when she was done with college and got engaged in the Denver area. And then it was too expensive for us there. So I always kind of knew we would land back in Iowa somewhere. My wife grew up in central Iowa here in Urbandale. So that's where we are now. So, but that experience in the sleep disorder clinic was great because it really just kind of confirmed that I wanted to be in healthcare. So once I moved back to the Des Moines area, started working in the sleep disorder clinic here locally, was building up contact hours, and I worked with a cardiac surgeon that we just kind of shared the same office. And he really kind of guided me towards the PA field. Actually, he said, you should look into this. Like if healthcare is where you're leaning and you've tried physical therapy, you should look at the PA program. So he actually lined up some shadowing. I shadowed a couple PAs in rural Iowa, and decided to apply at Des Moines University, and got accepted in there. And I guess the rest is history with that. So, but yeah, it was great. And I really enjoy where I'm at. You know, working in the weight loss field is kind of everything, all of my interests wrapped up into one here. So having a background of exercise and health, you know, those are obviously they apply to what I do here today too, and kind of what my role is here. So, and I'd be happy to talk more about that too. So.
Was this your first job as a PA, or did you have someone who stopped before?
No. So I actually, interestingly, you know, Des Moines University is a 2-year PA program at the time. It's a little bit more now, but I had 2 kids in PA school somehow. So at one point we had 3 kids under 3 years old. And so coming out as a new grad, I kind of wanted to be in a field where I wasn't on call, you know, or just needed family hours. So my first job was actually as a provider in a sleep disorder clinic. And so it was more like, you know, treating and diagnosing people with narcolepsy, sleep apnea, insomnia, restless leg syndrome, that sort of stuff. But the hours were great with that for sure when my kids were young. After doing that for 3 or 4 years, I realized that, okay, as a PA, I have to take a test to recertify my degree. Like at the time, I think it was every 6 years. And so then I started working at Mercy in downtown Des Moines in the ER, and I would do 1 shift a week. And so that was exposing me
just to
to,
see the stuff,
just to make sure I remember like the rabies vaccine, all the protocols and all the primary care stuff. So, but yeah, the sleep disorder clinic was great. It was a great start for me. And then worked in the ER for a while, paid off some student loans, did that. And then I've been in the weight loss field since 2013. So started working with Dr. Ibis at Unity Point in Methodist, helping with surgery, bariatric surgery. The surgery day was once a week, and then everything else after that was clinic. At Unity Point, it was mostly post-op bariatric care that I would do, and some lap band adjustments and kind of all this stuff that we don't have to deal with too much anymore here. So, but then I started working at Iowa Weight Loss in 2014. So we actually, when Dr. Ibis decided to leave at Unity Point, he explored options and decided to come here, and I decided to go with him. So I had the opportunity to stay where I was at Unity Point and just kind of wanted to build something from the ground up. So I was very involved in that, which was a great experience. Everything from picking the company name to the website domain to the marketing to the everything. It was great. We're in the back of the car on our drives back from Belmont trying to figure all this stuff out. So it was really great. And so, here we are 11 years later, and it's still going strong. So
wow. That's cool. I love the idea of all the different steps that took you to where you are now. And then there was in there a moment of like, okay, there's not a thing, we have to build it. Right. Yes. And I think that's so cool. And because I've, something that I've been thinking about and been hearing and seeing is like, you want to find that kind of fulfillment in your life. It's building something. You got to build something. Right. And so I think that's so cool that you've been able to be a part of that and do that.
Yeah. And, like anything, there's some growing pains with that and some live and learn, examples along the way. But, and I have to give Iowa Specialty Hospital a lot of credit too, because they brought us on here and basically gave us the keys to the car, like in terms of we'll support you along the way, but we don't know anything about bariatric surgery programs, and so Dr. Ibis obviously had worked in the area a long time. So there's a lot of patients that knew of him. And so that was a foundation too. But then, you have to do a good job to get referrals and, most of it is word of mouth, at the time, especially. So I feel like now more with marketing, AI, online, right? Geofencing and all that sort of stuff, marketing.
GLP-1s, because that's another thing with medical weight loss too, here at the clinic, like that's kind of pressing us with marketing too. Right?
Oh yeah, definitely.
Something you made, or you pointed out when you're talking about how you got to live and learn when you started the clinic. I feel like that was your entire 20s too, based on that story. Pretty much. You went through, you're like, nope, that's not right. Next thing up. Nope, that's not right. Next thing up. Okay, I thought about this. I kind of like this, but now I got to move back to Iowa. Like that's a pretty cool story of just pivots, lots of pivots.
Yeah, I think that summarizes today's youth too, trying to figure out what do I want to be when I grow up. So I have a senior in high school, right? And he's not quite sure, which I wasn't quite sure, which I don't know if anybody's quite sure, to be honest. You might have a plan, but once you get submerged into it, things can change quickly. I think I read something recently like 70% of people in the workforce aren't using their degree.
Is that right?
Yeah.
That doesn't surprise me.
It's just one of those things you think but I was just fortunate to fall into it, and healthcare is fulfilling, and there's a lot of areas that I enjoy about it. I love getting to know people too, and kind of what their struggles are and their background and different personalities, and that's just kind of me. So I'm a people person for sure. I cannot sit in a cube in a corporation. That's just not me at all. So,
oh my gosh.
So yeah, I'm very thankful for where I'm at, and I get to be a cheerleader, So my main role here is I help out with all of the weight loss surgeries. It's primarily the sleeve gastrectomy, and then support people after surgery. I do a lot of the follow-up appointments, at least for the first 6 months. It kind of depends on staffing and where the patient's from. And so sometimes it's less than that, sometimes more than that. But um, I just feel like one of my biggest strengths is just compassion and optimism, just trying to build people up, and encourage them along the way. I have worked at clinics where they kind of beat people down. It's very negative. I've worked with dietitians that are like that in previous spots where it's very demeaning and people don't want to come. They're going to feel like a failure, which I hate that word.
Yeah.
Patients say that all the time, and I can't stand that word. But, that's not the right approach. And I know from experience, like most of our patients have struggled in a lot of ways, whether that's emotionally, mentally, with health problems, with the stigma that's related to being overweight. There's a lot of discrimination out there. So I've learned that a lot over the years and heard some very sad stories. Even other healthcare providers, right?
Yeah.
Like treating them differently and
Yeah.
looking down on them. So I think at the core of what I do, I always keep that in mind, and just try to always provide a positive slant of things. I think that's really important.
Where do you think that comes from? Like that core you talk about, like that compassion, because I would totally agree with you. You are extremely compassionate. I remember when I first met you, like you just made this entire clinic feel, I felt the optimism. I felt the compassion. I felt, I just felt better about myself leaving that conversation with you. And it was probably just a brief hallway interaction, right? So where do you think that comes
I think it's innate. I don't know. It's not something that I force or that I think about. I think just at the end of the day, you're judged on how you treat people, and there's biblical stuff. You treat people how you want to be treated, right?
Yeah.
Like, so I think that's probably the foundation of it. But I hope it never changes.
Yeah.
Yeah.
And as you get older, sometimes maybe your
Get a little
personality changes
little more
a little
cynical.
bit, especially in healthcare. That
Sure.
can happen
Sure.
for sure. Just get a little jaded or whatever, however you want to call it,
Yeah.
right? Like, so I hope that doesn't change, but I don't know exactly where that comes from.
Yeah. I don't think you have to have an answer. I just totally agree with you. Yeah.
Well, tell me a little bit about kind of because obviously you've mentioned now the bariatric surgery.
Mm-hmm.
So, and then you're supporting patients in those first few months afterwards. So, what does their journey kind of look like from kind of that almost like emotional perspective? Because I mean, I think it's safe to assume that most people are losing some weight at that time, right? So,
Yeah.
what is it like to see someone from, a week after their surgery to now I'm seeing you at 3 months and 6 months? How are they different?
That's a great question. And I'll kind of walk you through it because, it's a big decision. Let's back up. Like to undergo a surgery, you're usually at your wit's end, meaning that you've tried a lot of different things, whether it's medication in this day and age, whether it's keto, all the diets.
Sure.
And understanding that most patients have tried stuff and maybe it worked temporarily, maybe it didn't. That's at the core too. We always have to keep that in mind because obesity is a chronic thing, right? And that's why people yo-yo. You might be able to do it for a while. Your body wants to adapt and make changes and put weight back on. And so there's a lot that's tough to deal with emotionally for a lot of patients. So that gets them to on the surgery route in a lot of situations. So I always see patients 1 to 2 weeks after surgery. That visit is mainly just to make sure there's not any complications or problems. Most people feel crappy at that point in time. They're tired. Their calorie intake is really low. You guys are torturing them with a full liquid diet. And so nobody likes that.
It's a brutal first 2 weeks for sure. Yeah.
It can be really rough.
Yeah.
But, medically, we're adjusting medicines. We might be stopping blood pressure medicines or really adjusting those quickly. We have a lot of diabetics. So, there's some adjustments.
Will you
Maybe with
explain that really
insulin.
quick though? So why would you be adjusting the blood pressure medicine so fast?
Yeah. So, what I've found, so we have the body composition scale, the Sika scale. There's a lot of rapid weight loss, shortly after surgery in the first couple of weeks for sure. And when you lose weight, water weight quickly, it drops your blood pressure.
Yeah.
Definitely. And so if somebody is on a certain dose of, let's say, lisinopril, 40 milligrams a day, for instance, and when they're discharged from the hospital, we don't adjust that. And routinely we don't. But when I see them at that 1 week appointment, for instance, this happened to me yesterday. it might have even been lisinopril 40 milligrams. I can't remember. But patient got up in the waiting room before I saw them to get on the Sika scale, and they almost passed out.
Wow.
So got dizzy, tunnel vision, sweaty, and it was because their blood pressure had dropped temporarily when they got up. So they were over medicated. I think the patient's blood pressure was like 90/60 or something in the room. And so, I mean, we stopped the lisinopril, right? It wasn't rocket science or anything. So my guess is that patient will feel a whole lot better as time goes by here. But I think it's a combination of losing water weight, not drinking well. You know, the first few days after surgery, that stomach is small, which is the point of the surgery. It's swollen, it's tight, there's just not much space. So it's really hard to drink. And so I think it's a combination of those things. But I would say out of all of the medication adjustments, blood pressure is the one thing. Yeah. And that's why I'm not a big fan of telemedicine. You know, early after surgery, we want to see them to check their blood pressure and just kind of check their vital signs and stuff. So, but that's just one example of how medication can change.
Because obviously a lot of people also go into surgery because maybe they want to reduce their blood pressure, maybe they want to reduce those cardiac symptoms. So
it's a big part of it. Yeah, and I would say that's probably the number one thing that can change. Is blood pressure management and decreasing medicine from that. Aside from diabetes, obviously, weight loss surgery, bariatric surgery can make a huge difference with that as well. Sometimes cholesterol. It kind of depends. There's such a familial genetic component of that doesn't always improve with weight loss. Triglycerides can definitely improve. Liver enzymes can definitely go way down with weight loss. Sleep apnea, if that weight loss is impacting neck size, that's a big predictor of that. So I gave you my background with sleep stuff, but we don't have to talk about sleep apnea or sleep disorder stuff.
Well, no, that's interesting though, right? I mean, because I think, if you have more on this, obviously jump back in there, but when I get done, but like the sleep apnea thing, like as that starts to become less of an issue, it's amazing to watch people, how good they feel.
Oh yeah.
And it's like, I went from broken sleep for 4 hours a night to I just slept for the first time ever 5 hours straight through.
Yeah.
And obviously that's not enough, but at the same time, it's like way more than what they've been doing. And so it's like, wow, imagine how, and then they come back 7, 8, like, it's wild.
Yeah. So it's interesting because this stuff is all in my past, right? Working in the sleep disorder clinic. And now we talk about sleep apnea today and the benefits of weight loss today. I remember when I worked in that field, we would talk about even losing 5% of your body weight can make a huge difference to improve sleep apnea. The studies showed that even 15 years ago, but I didn't really have the resources to help them too much. Right. And so if I could go back, things would probably be different, but I can do it now. Right. And so the GLP-1s are indicated for sleep apnea. And so I think my background has just brought me to where I am today. So it's a lot of things with health, exercise, the sleep apnea experience, is great. But when I was working full time in the sleep disorder clinic, I would see that all the time with treating sleep apnea, like even using a CPAP. It was just amazing how people would feel. It was life changing. It would change their personality. And, I think we undervalued the importance of sleep, in this society.
Even now. I feel like we talk about it all the time, and I feel like it's still undervalued.
Well, it's hard because you can't try. There is such thing as trying too hard to sleep, right?
And then you stress about it, right?
Oh gosh,
it's really crazy. But sleep quality is very important, and especially when you're losing weight rapidly, your body's going through a lot of changes. Like the sleep part is huge. That's a huge aspect as well.
Recover, right? When your body's going through those type of changes.
Yes,
and for the best recovery tool, sleep.
Yeah.
Right?
Yeah, so that's the 1 week stuff. So sorry I got off track with your question. We're going to walk through the different stages. And then the normal follow-up schedule after surgeries, I see them 6 weeks out from surgery. And usually that visit, they're starting to eat a little bit more normally. So we're talking a lot about the ability to tolerate foods. You guys know more about this than I do, but that's a big topic. We're looking close at their body composition changes at that visit. And, the common question that most patients have is, am I on track? How's my weight loss? Because 100% of patients feel like it's not good enough. no matter what. No matter what stage they're
Yeah.
at, they feel like it should be more, even though we might lay it out there before surgery. Like, these are the typical expectations of weight loss. They forget that, and nobody's perfect. And so people come into it thinking, oh, I made one or two bad choices. It probably has little to do with that, right? So it's a lot of emotional support, a lot of mentally, and just perspective, just making sure that people understand, oh, you're doing fine. Plateaus happen. Like between that first visit and the second visit, people hit a weight loss stall after surgery, which is totally normal. It's your body just trying to hit the brakes a little bit. And then for no rhyme or reason, I believe for no rhyme or reason, it just happens again. They're already in a calorie deficit and nothing has changed, right? But the human nature is to think, oh, I'm not doing enough protein supplements, or I'm not exercising enough, right? And I just don't buy it. I don't think it has much to do with that. And that's just a small example. No matter what stage they're at after surgery, that's a common theme.
We just had, we were telling you about the Jennifer Brown that was on here, and she was talking about she went through an 8-month stall.
Oh, yeah.
And she was so ready just to quit. But earlier on in that conversation, she was telling us about how like people, or she would internalize that these things were her fault. And many people probably fall in that situation, right?
Definitely.
So when that plateau happens, you kind of revert back to, your native brain, or you were 6 weeks ago, or whatever the case was. And it's hard to kind of navigate through it when it was, maybe dropping pretty quickly before.
We want feedback. We want validation that, oh my gosh, my hard work is paying off. Look at this. And unfortunately, the scoreboard is the scale, right? It's the numbers. And somebody can get off a lot of medicine and feel great and feel amazing. But if that scale goes up a couple pounds, they freak out and they forget all the other stuff, right? And that's just the emotional part of it. And some of that might have to do with the background of the fear of, oh my gosh, I'm gonna gain all this weight back. Oh, there's so much of that there.
Someone who's already yo-yoed a bunch, and so that they're like, it's happening again. Like, oh man. So
yeah. And and I think because in this day and age there's so many medications that are available, and there's great. They work really, really well. People oftentimes come in wanting to talk about that after surgery at some point. I really resist that for sure the first 9 to 12 months after surgery. I try to avoid it, but after that point, often that's a topic we discuss. And so, and whether that's because the patient tried them before surgery, or they know somebody else, a friend, a coworker, or whatever, that said, good luck. Yeah. And I think Dr. Ives and a lot of the other providers here talk about, hey, we might have to do both, like extra tools in the tool belt. We might have to do both of those. So, but I do feel like these days I'm talking more and more about medicine after surgery at some point here. So,
okay, so that's 6 weeks out.
Oh yeah, 6 weeks. All right, let's get back on track here. So then I see him at 3 months out, and the 3-month visit, the main thing we're checking is labs, and we're just making sure there's not vitamin deficiencies, and it kind of gives us a baseline too, right? Like for some of those vitamin levels. That way, when we check them at the 1 year post-op visit, we have something. We can compare it to something. Weight loss. Let's just talk about typical weight loss. So for the first 5 years after starting this program, 2014 to 2019, I kept track of everybody's weight loss, and everybody's, the typical weight loss at the 1 week appointment, 6 week, 3 month, and on down the line. Really paid attention to muscle mass changes, fat mass changes. Didn't publish anything. This was just for my knowledge because I was curious. So I did that for 5 years, and then COVID hit, and I decided I'm done with this. So I have a lot of data. Like 5 years, there was like 1,500 patients or something in there that I tracked. And the unique part about it, I think, is we only do one surgery. So it's the same surgery all the time. So I think that helps to really get accurate kind of expectations. And it's always like excess weight loss, right? That's kind of what we look at in terms of where somebody's at. So if a patient starts 100 pounds overweight, the typical national average weight loss is to lose 60% of their extra weight. So we would expect them to lose about 60 pounds. And so at each point, and we don't have to go through every visit here, but I kind of look at that, like just off the top of my head, at the 3-month visit, if we're talking about that, people are usually down about 40% of their extra weight. So they've lost about 40 pounds. By 6 months out, which is usually when I see them again, we're talking about half, about 50% excess weight loss. Patient be down about 50 pounds if they start 100 pounds overweight. We like to look at percentage because it depends on where you start.
Yeah.
You know, we can't say exactly. Who knows for sure? But somebody that's 200 pounds overweight will be down 100 pounds at 6 months. And so what's interesting about it is that the 6-month appointment, it seems like people are going to do pretty well regardless. You know, like even if their habits aren't the best, even if they haven't exercised, like it's pretty consistent with that. But then those habits can catch up with people after that point. And so for the first 6 months, patients are typically really happy. They're feeling great. It's the new me, similar to the sleep apnea treatment. Like, and maybe that's why I'm gravitating towards these fields where there's like people are pretty happy.
Yeah,
you know,
excited.
patients they change.
This
like,
is awesome.
Yeah, look at my health improvements. I feel pretty good. The contrast of that is when I worked in the ER. Nobody's happy in an ER, right? They're in the waiting room for 4 hours. Just aside from all the other stuff,
right? Yeah.
So it's rewarding, and then after 6 months, I would say I usually see them at the 9-month post-op mark. There's not a whole lot of changes at that point, maybe a little bit, and then usually by 1 year, most people have lost a majority of the weight that they're going to. It doesn't mean they won't continue to lose, but for the most, that's why I guess circling back to the question, that's why I don't usually talk about weight loss medicine and stuff until about a year out, because changes are still happening, and most patients are trying to avoid that because of the cost and whatever, a lot of other reasons.
Wow, that's quite a journey that for that year that our patients go on, isn't it? Man,
it is.
Holy cow.
Yeah, it's wild. And then, after that, some programs, unfortunately, are kind of done with people after that. I'm not sure in the field, like patients don't get a whole lot of support after a year, which is unfortunate. Yeah. It's almost like, okay, you graduated and you're done. But I think what we know from obesity is it's a complex, chronic thing. You have to stay on top of it. You have to be consistent with your exercise, your food choices, prioritizing your sleep, all that stuff just to keep your weight off.
Yeah.
And that's where emotionally it's a lot different, right? If you're not getting, I'm trying so hard, and it's just patients can get frustrated. Even if they've lost 80 pounds, let's say they started 100 overweight and they've lost 80 pounds, but they don't have the results, at some point, or God forbid they gain 5 pounds, they're just going to freak out and start thinking, oh my gosh, we got to do something here. Whereas my perspective as a provider is you're doing amazing. You're whatever, couple years out, you're down 70% of your extra weight.
Yeah.
You're doing really, really well. It's just if between that last visit and the current one, they've gained 10 pounds. That's all that's on their mind.
Yeah. We have that perspective to zoom out a little bit. And that, maintenance is something I don't think we talk about enough here, unfortunately, but that's one of the most challenging parts about it, right?
Oh, man.
It's with any goal setting when we think about it, because you set that goal, you've been working towards it for, let's say that year, maybe 2 years, and then you kind of have that struggle point. Well, what is that goal after that? Well, it's maintenance. And what does maintenance look like? And it looks very different for everyone.
It sure does.
Incredibly challenging.
Well, I think one of the challenges is, like, as we're thinking about this, is so much of our goal setting is shaped around sports and athletics, and it's looked at through that lens, right? Or creating a piece of art, right? At some point, you've made the clay pot, right? Or you've won the championship and you're an MVP and it's done, right? Health and managing a chronic condition like obesity is so different from a lot of the other things, and we don't really celebrate that maintenance period until someone's like 85 running marathons, right? You're like, wow, look at them. Well, it's not they didn't just pick it up. They can do it now because they've been living a life of activity and eating well and doing all those things for years and years and years and years and years. But we don't celebrate it until that point.
No.
And so no one sees it's what is it? The metaphor of the duck on the water, right? It's all you see is the smooth on top and the feet underneath are just going crazy.
Oh yeah.
Right. That's what that is. And so That's a challenge to get across to people, is like, hey, this is going to be a lifetime of hard work.
Oh yeah.
That is the reality, but that's okay. You get used to it, right?
I think people don't. We have I think we have decent retention rate in terms of like, we try really hard to express to people like, we want you plugged into the program, not to do unnecessary visits. It's just more like, we know, I've seen it too many times where a patient hasn't been in for 2 years, they come back and they've gained a lot of weight back. And some of that's shame, and it's not easy to walk through those doors, and I understand it. I get that. But it's really, really important, and that's why we send letters once a year when it's about the time of their surgery day, and just try hard to keep them plugged in. Obviously, we're checking labs and some of the medical stuff, but just to stay on top of it, and
just be a support system. Right. Yeah.
It's a big deal.
Should we transition to GLP-1s a little bit?
Sure. Yeah.
Because you actually mentioned something a little bit different than IBIS did. IBIS was talking more so about potentially having medications sooner after post-surgery. So I kind of want to get into that a little bit, because you were a little bit pushing 9 to 12 months out. Ideally, it sounds like 12 months. And he was thinking, based on some of the literature he's probably talked to you about, closer to like 3 to 6 months.
So it's a great question. Or I know it's a great topic. Sorry to cut you off. Fine. And great question. Because philosophies are different.
Yeah.
And mine, I think my perspective molds kind of what I feel. My experience molds my perspective, meaning that I don't want to talk about that or introduce them too soon, because of what we talked about earlier, people feeling like it's not good enough. If somebody is on a trajectory, let's say 6 months out from surgery, and they're doing well, and they've lost 20 pounds between their 3-month post-op visit and when I saw them at 6 months, to say, oh my gosh, we need to start you on a medicine at this point in time, I think just psychologically and emotionally, that's a tough sell. And I don't want to do that, because I want to make sure we haven't maximized the benefit of the surgery yet.
Yeah.
So I do think they're synergistic, and there's research that shows that for sure.
Absolutely. Yeah.
But that doesn't factor in the emotional part of it, and the patient's willingness to do that. Because I think all of us would probably, we don't want to take something unless we absolutely have to.
Yeah.
Right? Whether that's anything, any medicine.
Yeah. Wow. Yeah.
Well, it's interesting that you say that, and I don't know how controversial this will be, but I often have came across people that will like refuse blood pressure medication or cholesterol medication, but are open to maybe GLP-1s, right? And why is that? And I think that's a bigger topic for another time, but it's just interesting that you mentioned that some people don't want to be on a medication, which is totally understandable. Everyone's different, right?
It is. I think it's even vitamins, right? And people just don't want to take stuff, no matter what it is. So, but yeah, to your point, there's a lot of controversy with that.
Oh, yeah.
So, and maybe that person, just that example, they just know that how much weight loss impacts their blood pressure. Like
sure. Yeah. Good point.
Right? They're playing. They're like, they're next level. They're deep, right? They're like, I know the core of why.
Yeah. Exactly.
Oh, that's awesome.
Yeah. Well, unfortunately, we do need to cut this a little short, because Derek has a dentist.
Got to take care of the teeth.
There you go.
But
I dodged a bullet with that. All right.
Well, no, Jon, I really appreciated this. This has been fantastic. I would love to have you back on and go more in depth on maybe that post 12 months, or more on GLP-1s.
Or sleep. I think I would love to get into that more as well, too. Yeah. Right. Yeah. So I think there's definitely more to explore, and for both the health of my own smile and the ability of our listeners to stay focused for more than 45 minutes. I think this is a good spot to pause it.
I'm kind of reaching my limit too with the focus here, so it's all good.
No, it's
not you.
It's just me and my glasses off. Is that?
Just me.
Oh man. Well, thank you so much. This was awesome. And again, this was the Wellish podcast, and look forward to having you all tune in again next time.
See you.
Thanks for having me, guys.
Yeah, absolutely. Here.